biggest rumors about recruitment for healthcare staff in the UK is that there is going to be a permanent reduction in the recruitment of international healthcare staff in the UK because the UK is obviously seeking to increase domestic recruitment for NHS professionals. Now, if this is something you are concerned about, especially because you might have completed your degree in any healthcare stream, you might have given your IELTS or in the process of applying for your HCPC registration and are worried if all of that effort is going to be wasted, then let me tell you that today's video is going to give you a lot more clarity about what is it that the people in the UK are saying based on current research that has spanned across 2009 to 2023. Now, if any of this is of interest to you, let me introduce myself. My name is Nikita and I make videos about getting your HCPC registration, clearing those interviews and coming to the UK as a healthcare professional. And if any of this is of interest to you, please do not forget to subscribe to me on YouTube, but also follow me on Instagram. My handle is physiotherapy in UK. So let's get into the details of what I'm about to share with you. So before I introduce anything, I do want to introduce what the research is that I have been trying to introduce through this video through you. So as you can see on your screens right now, this is the King's Fund, and it just says that the King's Fund is an independent charitable organization working to improve health and care in the UK. So obviously this King's Fund has been really influential in driving some of those key policies that tend to influence some of the changes in the NHS generally across the entire UK, which is made up of the 4 nations like we know, that is England, Scotland, Northern Ireland and Wales. So if we come back to the page where the King's Fund has given some recommendations about the NHS workforce in the nutshell, you can see that this specific research was released on the 10th of May 2024, which is not that long from where we are right now in July. So all of the findings from this particular study are obviously very relevant, very valid. Now, what it goes on to say is that they obviously know that the NHS is facing a workforce crisis, but how many people work in the NHS in England and what is their work roles? And this is really important from an area of trying to do workforce planning, which is trying to identify the number of people required to fill the job roles in the future. And as you can see on your screens right there, that is the workforce by staff group. And as you can see, there are obviously junior doctors and consultants, but there are also bigger other staff groups that are meant to support the doctors and the consultants. And as you can see, one of the biggest ones over there are nurses and healthcare visitors. But right under them, you can see that there are scientific, therapeutic and technical staff, which are obviously your physios, OTs, healthcare scientists and so many others. Now, what I want to highlight over here is that based on this particular diagram, you can see that obviously there are different number of professionals working in different sectors within the NHS based on their job roles. Most of these job roles cannot clearly be put into a specific category. So for example, nurses and health visitors have a specific category, but many allied healthcare professionals may fall under the scientific, therapeutic and technical staff category, but some of them might also overlap in support to doctors, nurses and midwives. So again, as you can see, these are the biggest categories over there where so many of us tend to get employed under the NHS. Now, what I want to draw your attention next to is the change in the numbers over the time period that we've discussed. And as you can see on your screens, the graph right there shows that there has been general tendency of increase in healthcare staff across mostly all sectors except obviously the infrastructure and support staff. But the green one over there, which is what I want to highlight, is obviously the scientific, therapeutic and technical staff, which is all of us allied healthcare professionals, and the one just above it are support of clinical staff, which can again be a lot of allied healthcare professionals included in that category. And what the King's Fund has to say is that a number of the NHS full-time employed staff has actually grown 30% over the last few years. But obviously, all of this growth has not been evenly spread. So as you can see, some of the highest rates of growth are seen within the hospital and community services, such as doctors, but also in healthcare, such as nurses, health visitors, midwives, and obviously scientific, therapeutic, and technical staff. Now again, what I really want to show you, and this is again in no way a prediction of the next few years, but what I really want to highlight is I want you to see how the recruitment of staff generally in the NHS has happened over the last few years. As you can see, the numbers have again generally been rising. And again, if you sort of want to point out to physios right there, you can see that initially in September and 2010 to almost September 2013, there was hardly any recruitment for physios. But since then, the recruitment has gone up really high, almost to 38% in September 2023. Now, again, that goes to say that that's obviously massive recruitment happening for physios. But in terms of some of the other professionals, such as radiographers, for example, who obviously come under the Health and Care Professionals Council, that is HCPC, you can see that there's been massive ongoing recruitment for radiographers right from 2012 all the way increasing to 54% in 2023 September. And that's not all. Look at some of the other graphs over there. There's only been a decline in a few occupations such as nurses with learning disability, nurses within the community, and nurses within mental health. Now, that doesn't go to show that there has been no recruitment. What it actually goes on to show is that there have been a lot of people leaving these jobs, but there are still a lot of number of people recruited for these roles within the NHS and the UK. Now, if any of this doesn't make sense to you, let me know in the comments below, and I will try to be a bit more clear about it in my next video. But moving on to international staff, and this is what I want to highlight in this video, is the current immigration policy allows health and social care staff to apply for visa to work in the UK for up to 5 years. Now, although we have the option to work in the UK up to 5 years, most employers offer us visas to work in the UK for up to 3 years. The NHS would not be able to function without its international workforce. This is key, guys, who account for nearly 1 in every 5 people who work in the health service. This is massive, because just imagine there's 1 out of every 5 people in the NHS who's recruited internationally. Some of the job roles are more reliant on others as for international staff. For example, international staff make up to 37% of doctors compared to just 5% of the managers, which is something that makes sense, isn't it? Because obviously the international recruitment began quite heavily between 2010 and has gone on right now, whereas most of the managers in the NHS are people who've been here for much longer than that, who are sort of closer to that near retirement age. But as you can see, again, massive recruitment of international staff has been obviously happening for doctors. As you can see right there on your screens, maximum recruitment of international healthcare staff is obviously happening for doctors, nurses and health visitors. But if you come right down there, you can obviously medical support and technical staff, which is again areas of allied healthcare professionals working. So as you can see, those are right on the top there for massive recruitment that has happened over the years. Now, again, not to say that this is going to predict what's going to happen in the next few years, but if the past is a good indicator of anything, it is that the NHS has realized that international healthcare professionals are required in order to fulfill some of those vacancies that are in place and provide healthcare to people in the UK. It might actually be in favor of recruiting more internationally trained healthcare professionals, and the reason for this is again coming down to the number of vacancies in the UK. So as you can see on your screens right there, it says that the vacancies remain a big concern, with an estimated of 1 lakh posts currently unfilled substantially. Although the NHS workforce has been growing, the demand for NHS services has been growing faster, and the healthcare service has not been able to recruit and retain staff to keep up. As well as doctors and nurses, vacancy rates are high for all other NHS staff, including allied health professionals such as physios and OT. And should I even go further? Because as you can see right there, there has been a massive all-time high in the number of vacancies that have been going on for almost all allied healthcare professionals. And if I have to just pull up the graph over here just to show you what has been happening, as you can see, there are over 1 lakh posts vacant. Now, these are obviously split up, as you can see on your graphs, between nurses, doctors, and other healthcare staff. And if you see over there, right in the 3rd quarter of 2023, or in the 4th quarter, there was a dip in the number of vacancies, but they've again gone up at the start of this year and have continued to be high. And in terms of the other staff, there are almost about 67,000 vacancies live across the entire UK. So that is in England, Scotland, Wales, and Northern Ireland. Now, that just means that all of these vacancies are open for you guys out there, for you to be recruited, for you to start your lives in the UK, provided you match some of the requirements for the jobs. And this is where we come in to help you, because if you are somebody who is struggling to make job applications or to clear interviews, please do not be stressed. You can book a one-to-one session with me where I can give you guidelines on what is it that you need to write in your job applications and what is it that you need to do in order to strengthen your supporting information sections. Now, I know that this is something that so many of y'all have concerns about, because obviously the system of applying for jobs in the UK is not the same as the one back in our home countries, whether that's India, Pakistan, Bangladesh, or the Philippines, or Turkey even. And that is why please reach out to me through the website link in the description below and book your one-to-one session with me so that I can help you. Now, I hope that this has cleared out a lot of those myths about that there are no jobs in the NHS for international healthcare professionals. But if you still have any concerns, let me know in the comments below and I will try to make a follow-up video about it. That's it for today, guys. Take care. Bye.